going to hospital because of fears over coronavirus and the pressure it would add to services. The head of the NHS has urged people to go on seeking help if they need it with data showing that non-COVID emergency department admissions are significantly down. Well, joining me now is Dr. Ian Higginson. He's the Vice President of the Royal College of Emergency Medicine. Dr. Higginson, first of all, what about the incidence of people going to accident and emergency? How significantly is that down?
Good morning, Adam. We're seeing attendances down in emergency departments between 30 and 50%. Most of that is in more minor illness and injury, but we are worried that there are some patients with serious illness who aren't attending because they're anxious about COVID-19.
Should people be worried about going to hospital and catching COVID?
I think what I can say is that hospitals and the staff within them are doing all they can to reduce any risk of infection from COVID whilst patients are in hospital. So we're socially distancing patients as much as we can. We're wearing PPE, which protects patients from staff and also staff from patients. And we've changed many of our procedures to help us minimise the risk to patients.
And people are also aware that things like some cancer treatments have actually been put on hold. So it's a natural instinct, isn't it, at this time not to overburden the healthcare system?
Absolutely, and we all appreciate the support and efforts patients are making to protect the NHS at this difficult time. However, we would encourage patients who are suffering from potentially serious illness, things like prolonged chest pain, prolonged tummy pain or serious tummy pain, abnormal bleeding, shortness of breath, or symptoms and signs of stroke, those sorts of things. We would encourage them to seek medical help in the normal way. Emergency departments are still available to meet that sort of problem.
And I mean, are we seeing people having things like heart attacks and strokes, not phoning for an ambulance and perhaps dying?
We're not sure. There's some early evidence to suggest that patients are waiting longer before they're seeking help, but we really don't know what the real impact of that is at the moment. That's going to take some time to work its way through the data. But there are some early signs that this is happening, and we are a bit worried about that, yes.
Could one explanation for accident emergency being less busy is lockdown and different behaviours as a result, people not exposing themselves to the chance of accident or stress?
Oh, that's undoubtedly the case. So there's a decrease in road trauma. People aren't going out in social gatherings and mixing with alcohol and the attendant consequences of that. So there are lots of reasons why we may not be seeing so much of some stuff. However, we are worried that things which still happen, heart attacks, strokes, all that sort of thing, do still happen even under lockdown, and we would encourage patients to seek help in that sort of circumstance.
And are there any sort of lockdown-related problems that you're seeing emerging and spiking up in A&E?
So I think the three major concerns are we seeing patients delay their presentation because they're anxious, which is what we're talking about. There are concerns that patients with mental health problems or patients who don't have mental health problems may be suffering additional stress at the moment. And then there are also concerns about domestic violence or safeguarding in vulnerable households, particularly if there's a lot of alcohol being consumed at home. I think those are the three main groups we're particularly worried about.
So if you or someone you're with starts appearing to be seriously ill or gets injured, what should people do? Because I think there might be a confusion between, do they phone 111, do they phone 999, do they phone their GP, do they head for accident and emergency? What's the advice?
So things haven't changed essentially in that regard. NHS 111 is still there, general practitioners are still there, the ambulance service is still there, and emergency departments are still there. So patients should do what they used to do, and we will help find the right help for them or advise them what to do.
Dr. Higginson, thank you very much indeed for joining us. This is Sky News. Coming up in the next hour,